really working on your wellness and things that are specific to our group. What do we need to do for you to assist you to be healthier? So we really are going to strongly encourage everyone who is using our health insurance to get the HRA, get that personal information for you, and that also gives us good information as a holistic, as a district. What do we really need to target? What can we really do for our employees? So that information is going to be very critical for us and for you.
And just so you know, to kind of segue into the HIPAA privacy laws apply to us just like it does your health plan. So we're not allowed to share information from the medical side with any of the employer group at all. So just so you know, that's protected. And we do that not only by contract, but we do it even if we didn't have to, just because it's the right thing to do. Health coaches are available by phone, email, and they will be on site. And let me tell you that you already have a registered dietitian and an exercise physiologist. We'll also have a social worker that will be available to do some counseling in conjunction with your EAP program that you already have. But that's just to augment that. But the health coaches will be here on site to do not only group meetings and sessions. Just to give you an example, we will do things like a weight management program, smoking cessation, those kinds of wellness types of initiatives. But they'll be available to do individual counseling too. So they'll come on site, put a workshop together. We'll have a lot more information to share with you about the availability of the Wellness and Disease Management team, but it's a full-blown disease management and wellness program. It's not just a marketing piece that you call somebody and never see anyone live, okay? We do all of those. And the medications are dispensed, as I mentioned to you, medical services, labs, x-rays, and medications, if we have them stocked, and we'll have nearly 200 different medications stocked within a dispensary. There will be no narcotics or controlled substances. Things like OxyContin and some of the others that you've heard about or perhaps you use will not be available just because of the DEA requirements. It's a whole different set of requirements, but we will have a robust formulary that I think you have some information, Christine, already available, and that will be expanded in terms of what we'll be stocking in the facility. So and that will be at no out-of-pocket cost to you or your dependents, whoever's eligible. Okay? Here's one page of that booklet that I'm talking about that you'll receive after you get your blood draw. This just happens to be the total cholesterol group page. But it will be comprehensive. It will tell you what that particular biometric screen is, and it will tell you where you are. And each time you have a blood test, after you have your first health risk assessment, the following blood test will show up. The results will show up on your next annual health risk assessment so you can see how you're doing. And I will tell you something you probably already know. Almost everyone has elevated cholesterol sometime around Thanksgiving and Christmas. And they're trying to figure out what causes that, but we'll see. That'll be something you can pick up on as you get your screening done. The medications, as I mentioned, are going to be nearly 200 or right at 200 medications that will be stocked. If we don't have a med that you need, our physicians are licensed. They can write a script and you get it filled just like you would normally do now. You would take it to your retail pharmacy and that would be through your health plan. The idea is, though, we want to shift as many medications being dispensed out of our facilities as we can for you because that does reduce the employer's cost. Our cost for meds are substantially less than through your health plan. So it's a benefit to you, and we pass on those savings to the district. So it's to the advantage of everyone, except maybe the insurance company, to get your meds filled at the dispensary. The idea is that this model, you come to the health center for whatever your needs are. If there's a question, you're able to get seen by a physician. You have a minimum 20-minute appointment on a regular doctor visit, or you can have 2 or 3 appointments if it's a real complex issue, back to back. You schedule those yourselves. You get the medications, you get the lab, you get everything. We try to do as much as we can, one stop, so you don't have to go several places and take the time and the travel to go all over. Most of our medications, in fact almost all of them, we'll start with will be generic, but we'll let you know what the brand equivalent is, or if they're an alternative. There are some drugs, some brands like Nexium. If you take Nexium, theoretically there's no official generic drug because of the patent law for that particular med, but there are alternatives. Omeprazole being the alternative that's accepted by most. In fact, most physicians and insurance companies recommend you try omeprazole rather than Nexium or Prevacid or Prilosec. Again, we're not a pharmacy. What that means is if you bring an outside prescription in, I forgot to mention this in the first group, but if you bring an outside prescription in, technically we can't fill it. Now, in reality, we probably can, but you must see the physician. Under the dispensing laws in Florida, the physician must see the patient before a medication is dispensed. They have to make sure, and you want that safety, particularly with someone you've never seen before. You want to make sure that's the right med. Our body chemistry does go through changes, and sometimes medications either lose their impact because of a number of different chemical reasons or just tolerance. And so it's probably not a bad idea to get it checked anyway. So if you bring an outside prescription in to the physician, we can't technically fill that prescription, but we might be able to, once the physician sees you or the provider, once they see you, then they could dispense something that we have on site. That makes sense? Okay. This is the log on information, and Christine's going to pass out some information. She's not going to pass out. She's going to hand out information for you. This will be, we should be ready within the next few days for you to actually go online and get your registration done. It takes about, as I mentioned, about 2 minutes to register, and then you can either call or go online and get your first appointment set or get set up for HRAs. We'll have an HRA schedule. The reason we're not quite ready yet is we don't have the facility with a certificate of occupancy, and that causes several things that are dependent upon that. So as soon as we have that, and it should be this week, we think we'll have that maybe today.
Today, the only thing that's holding it up was when they did the electrical. They put in the wrong water heater, so they have to change the water heater, and then we're good to go.
So we'll be notifying you of when the scheduler will be open for you to go online or make that toll-free call and get yourself registered and then set the appointments. And we'll make sure that the district will notify you as quickly as possible. But it's very easy to go online. The access code, CCSD 8, is on your document that's being handed out. It's about the middle of the first page in red. So that's the access code you use the first time, and you only register one time. So I think information is being passed up this way for you. Log in. It's real easy. The instructions are there. And believe me, if I can do it, anybody can do it. Here's an example of what the appointment scheduler looks like. Now here's the way this system works best. If you schedule an appointment, and everybody schedules an appointment, we'll be really on time. We'll work hard. As I mentioned, the first couple of weeks we might have a couple of anomalies that happen, or getting staff who've never worked totally together, coordinating things. But in theory and in practicum, after we've been open a few weeks, it will be very smooth. People ask all the time, can I walk in? Let me answer that question. You can walk in, but let me tell you what it does. For those who've scheduled an appointment, it makes it uncomfortable if someone scheduled an appointment and another person walks in and they could have scheduled an appointment. So here's what you're going to be informed by the staff. We always train the staff to say, you have 3 options. If you'd like to wait, we'll do our best to work you in. And it may take a little bit of time, particularly if we're booked up. If we have an appointment, we'll book you right there if there's an opening right then. But if you want to wait, that's fine. And they say, well, I don't want to wait too long. Okay, if you have a callback number, give us a callback number, get the staff, and they will call you as soon as there's an opening or there's something that they can work you in. Or let's pull up the scheduler right now and see what's available. And if you say, well, I'm really running a fever, I need to just wait and be seen, that's fine. But I just want to let you know that we're going to honor those who have booked the appointments. Does that make sense?